Oh man, I am exhausted. Hey Mary, how are
Hello.
you?
Hi.
How's your day been going?
It's been good. How's yours been?
It's been pretty rough. I've been running around the hospital all day trying to take my patients' vitals on top of all the other stuff I have to do.
Well, have you not been using the Mouthlab?
No, what is the Mouthlab?
Oh gosh. The Mouthlab is this incredible new technology device that allows patients to get their vitals checked in a matter of seconds. Yeah, it's a small handheld device with a finger sensor and a mouthpiece, and it checks vitals in very little time. And it's very convenient because it's handheld and battery operated.
Oh, well, where would you use this Mouthlab?
Well, researchers and scientists are introducing it into the hospitals now, but eventually they want to provide access to the Mouthlab for communal healthcare.
It's so cool. What kind of vitals does it take?
Oh, so many measurements at one time. It can take breathing rate, pulse rate, blood pressure, temperature, and many more things.
Wow, that is so cool. I'm definitely going to talk to my supervisor about using this Mouthlab.
Yeah, you totally should.
As you can see with this nurse, the traditional way of taking vitals can be quite tedious. Multiple instruments must be used to take the vitals of the patients. The process takes several minutes, and when time should be cut down drastically to allow for nurses to spend their time elsewhere. Put down your instruments and get ready to be introduced to the Mouthlab, the most innovative way to take vitals in today's healthcare world. Welcome to the future. Mouthlabs are implemented into the hospital in almost every setting. Nurses can check vitals with a conveniently small device quicker than ever before. Mary is an experienced nurse, and she has been using the Mouthlab for quite some time now. She quickly and easily takes the vitals of her patients and then runs off to the critical care unit where her assistance is very needed. The quickness of the Mouthlab assessments allow for nurses like Mary to spend more of their time on the critically ill patients. Flash forward even more. The Mouthlab is now being used in home settings. Its small size and easy use makes it a great healthcare tool for patients at home that cannot make it to the hospital due to limited access or chronic illnesses. Nancy is in the ease of her own home and is able to use the Mouthlab to send her vitals to her physician. Nancy has limited access to her care facility, so the nurse is using telehealth to send Nancy's vitals to her care facility, where her physician will interpret her symptoms and vitals to decide what medical action to take. Thanks to the Mouthlab, this at-home healthcare transaction was quick and painless. The technology that Mouthlab provides furthers the quality of care the nurses are able to provide for the patient. With less time being spent on the routine procedures, nurses can give more attention to reviewing the vital signs and symptoms that the patients present. Personal care and support that nurses are able to give their patients is amplified.